before I became an occupational health, I was a mother-baby nurse. And so I had a pregnant lady come into the clinic, and I took her blood pressure, and it was a little bit high. She told me she had been at the doctor earlier that day and that her doctor told her it was fine. But using my skills as a mother-baby nurse, I knew that she could potentially be pre-eclamptic. And so I told her she needed to go back to her doctors. She went back. They admitted her into the hospital, and they did an emergency C-section. She later sent me flowers. I didn't know she had gone to the hospital, but she later sent me flowers and told me that I had saved her baby's life.
One day, one of my coworkers had chest pain. Because of the trust and were central in the manufacturing plant, he actually was in my office in less than 1 minute from his initial set of symptoms. Every time we speak, it's always, I wouldn't be here if it wasn't for you.
She called me from a car one time and said she was contemplating killing herself, running off the road. So I was able to take that moment, have her conversation with her, redirect her, get her into our employee assistance program resources. She took that story to our vice president of HR, who was really touched by that. And he didn't, it was an aha moment for him that occupational health nurses save lives, That took a lot of rapport and development over the years in order to foster that closeness or that relationship where she trusted me to give me that call. She didn't call her family, she didn't call the police, she called the occupational health nurse practitioner.
When he had that stroke, he realized that, he got to the doctor in time, minimal long-term effects from that, in fact, no long-term effects for it. And then he actually started a program, Biking for Life, as a result of that. And so he tells people, well, it was because of the nurse and her advocacy for blood pressure that I did that.
In Bryn Mawr Hospital, and we actually did employee health, but we also did some primary care for employees, mostly triage, that they could come to us for health questions. And it was 3 days before Christmas, and I had a young woman and her husband come in, and she had this very bizarre abdominal pain. And I had evaluated it, and it was quite concerning. I was really worried about the tilt. And I got there, and they said, the doc's not in today. So I wheeled her directly to the emergency room. By the time I got her to the emergency room, her blood pressure was 70/40. They had her on the operating table within 10 minutes. She had blown a splenic aneurysm. And the really sweet part about it is she survived. And every year on the anniversary, she would bring me a bunch of, makes me cry, she would bring me a bunch of daisies because she told me she'd be pushing them up if it weren't for me.
We had one of our DOT drivers, Department of Transportation drivers, that was not driving properly, and the supervisor sent him down to the clinic because he thought he may have been under the influence, which is a reasonable suspicion. Further evaluating him, we discovered that he had a new onset of seizures. And so just that program being a part of our occupational health, we were able to identify there was a problem and eliminate the possible reasons and then discover what was really going on. And he was able to get treatment without hurting anyone and get on a proper therapeutic program to get him better. And he is still working for the city and in a different role, of course, and still being productive.
It's one of those things that you do what you do, and you help people, and you make a difference in their life, but when they come back and thank you for that, it's like, yeah, I am where I need to be. I am exactly where I need to be.